Now we'll talk about anesthesia for neurosurgery, focusing on cerebral aneurysm. The patient is a 47-year-old female who suddenly developed the worst headache of her life, as well as developed increasing nausea and vomiting. EMS was called and the patient was transferred to the ER. The patient arrives to the ER after having performed a thorough history and physical examination. The patient's immediately sent for a CT angio of the brain, which reveals an intracranial aneurysm. The question that arises is, how do we determine the relative severity of the patient's cerebral aneurysm? Certain factors which help determine the severity of the patient's cerebral aneurysm include the classification such as Hess and Hunt, the size of the aneurysm, as well as the location of the aneurysm. After having evaluated the patient and reviewed the CT, a decision must be made whether to observe and provide supportive treatment for the patient in the neuro ICU or head off to the operating room for early surgical obliteration